Hello everyone. The video today is about the successful treatment of a case of heavy metal issues. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So I've been doing a little video series about the successful treatment of various conditions. I've done a chronic Lyme case, a mold toxicity case, a POTS/dysautonomia case, and a MCAS/histamine issue case. And so today it's about heavy metals. Someone had posted a comment on one of my other videos a little while ago saying, could you please post some videos about successful treatments of some of these conditions, because those of us who are in the throes of dealing with them could use a little optimism to see that, folks can actually get better when they have these conditions. So that was the inspiration for this little series, and here's the heavy metal one. So with heavy metals, heavy metals are a little bit tricky because heavy metals are treatment for heavy metals doesn't doesn't really regularly lead to really obvious improved health outcomes, at least in my experience. When I talk to colleagues and we're chatting about things and picking each other's brains, that tends to be the feedback that I get from colleagues as well who look at and treat and remove heavy metals. The reason I say that is because, that's what we see in clinical practice, and what I see and what I've heard by proxy from other clinicians. And my understanding is the reason that we see that in practice is because heavy metals are really more of a burden or a yoke, if you will, around the necks of our cells, particularly around the necks of our mitochondria. Very, very important little energy producing units in our cells. They produce energy and so much more. But they're kind of have a bit of a stranglehold on those mitochondria and interfere with other cellular processes as well. They deplete us of antioxidants. They interfere with our methylation cycle, which is important for many physiological processes in the cells, et cetera, et cetera. And so when we get rid of those heavy metals, it's kind of taking a burden off of the shoulders of the cells and the mitochondria and whatnot. But once that burden's been taken off, it doesn't mean that the cells just bounce right back to feeling amazing. It can take some time for those cellular resources to replenish, for those mitochondria to replenish. And also when heavy metals are afoot, it's oftentimes, and it's a bit of a chicken or egg situation, but they're oftentimes coexisting with mold toxins or chronic infections or other chemicals that have accumulated or possibly other concomitant issues. And so there's kind of a hodgepodge of things, and metals are just one of the several things that are having a negative impact on a patient's health and physiology. So it can be a bit tricky to see a case where we do chelation therapy, for example, to get rid of heavy metals, and the patient's just feeling progressively better and better. It tends to be more of, we got rid of the metals, and then it seems that the person is able to better respond to those other treatments, or they'd say hit a plateau, and then over the next several months, they're gradually getting over that plateau without bringing in other new interventions. So I guess a good way to summarize heavy metal removal therapy, which is typically done through, I think most effectively done through chelation therapy, and maybe typically done through chelation therapy. Maybe that's an appropriate descriptive word as well. It tends to be quite anticlimactic. We get a patient moves out of a moldy environment. It can lead to a dramatic improvement in health. Not in everyone, but in some cases, dramatic improvement, or we find the right low dose immunotherapy formula to address a patient's microbial hypersensitivity. They feel very markedly better very quickly, or we finally get the patient on the systemic antimicrobial treatment that they need at long last, and they start feeling notably better. With heavy metal removal therapy, it tends to be much less obvious. It's more subtle. It's kind of just a lot slower to see those results. So it's an important therapy. It's an important thing to do. We have reams and reams of research evidence telling us that heavy metals are really, really bad for us. Everybody knows that they're bad for us, but they're implicated in cardiovascular disease and dementia risk as a risk factor for dementia development. Many of them have been shown to be carcinogenic. They're just really, really bad for us on many fronts. So good to get rid of them, but anticlimactic. So with all of that being said, I've been searching through my brain, thinking about patients where there's kind of a more obvious or dramatic clinical outcome from removing those heavy metals. And so this is the story about that. So that long preamble aside, this is the story about a successful treatment of heavy metal removal. So this patient, I was working with them probably about 8 or 9 years ago. Remember, it was at my old clinic, which we moved to my current clinic probably about 7-ish years ago, maybe 8 years ago. So quite a while ago. And this patient came in and had a lot of diffuse pains, like muscle pain, joint pain, and kind of described as deep bone pain, which isn't always due to heavy metals, but it can be, and also a lot of fatigue and brain fog. And just as I'm fond of saying in these videos, just a friendly reminder that brain fog, to my understanding, is essentially fatigue of the brain. So it was fatigue, body fatigue, brain fog. I, of course, like a dutiful, earnest clinician, I, asked the patient, well, okay, when's the last time you remember, like, when did these symptoms start? And, they started, I don't know, 5 or 6 years prior or something like that. Did anything happen around that time? Not really, just kind of gradually seemed to happen. Okay, so like around that, and folks have lots of things going on in life. We're not all sleuthing our health and sleuthing our histories all the time. So looking for patterns. So I said, okay, like, did you move anywhere new? Like, did you start a new job? Did you change your diet? Did you, start a new medication? Like, what was happening around that time? And so what basically came out of the conversation was that this person and her husband, they had, purchased this home that they were, just going to eventually move into, but they were just gradually renovating it. And so, every weekend or something like that, they would go, or every weekend they would go and work on it for, a few hours here, a few hours there, and doing this work. And so it turned out it was a very old home, and they were doing a lot of, they were sanding the walls to, I guess, peel off paint or something like that. And so I thought, well, it's an old home, it's like 100-plus-year-old home or something like that. I wonder if there might still be some lead paint kicking around there. And so we went up doing a heavy metal test, and lo and behold, the patient had notably elevated levels of lead. So we started some chelation therapy. So we were doing these weekly intravenous treatments with EDTA, best intravenous chelator for removing lead. And with the patient, this was at a time when I was doing, let's see here. I was doing some of my own IVs at the time. Now I've been spoiled for several years with resident naturopathic doctors doing IVs for me, but I was following with this patient every week. So she must have been coming in on the days when I was doing my own IVs for patients. And so we'd, touch base every week, doing the IV, and I'd ask her how she was doing. And, for the first, like, maybe 3 or 4 weeks, she was like, I'm just not really feeling any different. This is back in the sad old days when I didn't have comprehensive mitochondrial support protocols at my fingertips. I was just basically offering the chelation, had some vitamins and minerals in the mix to help support her detox pathways. At the time, we didn't have really great oral liposomal glutathione, which I would always recommend to patients undergoing chelation therapy in my practice nowadays. We'd had IV glutathione, but, cost was an issue. She was like, I can do the intravenous chelation, but that's about it. So be it. So she wasn't on a whole lot of extra support, like physiological support. We talked about diet a little bit and whatnot, but that was about it. So you're really just, working on getting rid of these metals and just a little bit of, phase 1, phase 2 detox pathway support. So first, 4 or 5 treatments. I remember anyways, I remember the vibe in the room for the first 4 or 5 weeks where it was kind of like, buddy, this really isn't helping. This really isn't making a difference. I'd ask her some making small talk while doing the chelation, hooking her up to the IV and everything. It's like, oh, so how are things going? How are the pain levels? How's the fatigue? How's this and that? It's kind of like, I'm not really feeling any different. Not really feeling any different. And it was around the 5th or 6th treatment, 5th or 6th week in, that even before we started the treatment, like I could just tell there was like a difference in the air. Like she was in a better mood, and so we started the process and asked her, so how are things going? She's like, I'm actually feeling somewhat better. It's not huge, like it's maybe 10-15% better, but my pain levels aren't as bad. I'm not needing as many pain meds. My energy's a little bit better. And like the gist was like, I'm cautiously optimistic about this, but like I am feeling some difference. So I was excited about that. She was cautiously optimistic. She was somewhat excited about that, and just like clockwork, every treatment beyond that, it's like I feel a little bit better, I feel a little bit better, I feel a little bit better. And it was maybe a 5% ish improvement per treatment after we did, say 8 or 9 treatments. We did a retest and saw like, yeah, blood levels are coming down, not quite there yet. I think she wound up needing to do somewhere in like the 15 to 20 treatment range to get her levels all the way down. But it was just this nice stepwise improvement, and she felt, markedly better. She was like, 80, 90% back to where she was at baseline. And with the case, if memory serves, she was markedly improved, and so, but then, we retested, her levels seemed to be down to, they were down to an acceptable range, and for like maybe there were maybe 3 or 4 treatments near the end where she was like, yeah, I'm still like about 80% better, 80% better, 80% better. We weren't seeing any further improvement from there. So, we would have had a conversation. It was quite a few years ago, so I don't remember the exact details, but the gist of what I remember is that we would have had a conversation around, well, there might be some other things going on, your body that's bamboozled with heavy metals. Is there maybe some viral reactivation that happens? Is there maybe some other, underlying issue? Maybe there's something with your gut health. When a person's body's been through a lot, whether it's from heavy metals or Lyme or mold or some other nefarious influence, it can, unfortunately, it is what it is. It kind of turns into a bit of a day of reckoning for a person's body, where the body's like, yeah, I was dealing with those chemicals, or I was dealing with those allergens, or I was dealing with a little bit of gut dysbiosis, but I was, keeping it together, not really causing any symptoms. Well, then the body gets bombarded by something like these super toxic heavy metals, and then the body's like, like I can't really get you all the way back to 100% baseline health until we start dealing with, start addressing some of those other things that previously the body could kind of sweep it under the rug, but now, everything's out from under the rug and everything kind of needs to be worked on. And so she really didn't want to go there, which is fine. Her prerogative, her body, her health. I'm just here to give folks advice, and the best advice that I can. And so I recall that, we didn't have like a 100% resolution. She wasn't 100% of the way back to baseline, but she was markedly improved. And I feel like there's a good chance that were we to go down a couple of those other pathways or rabbit holes, depending on your point of view, then we probably could have got her, closer, if not all the way back to that 100%. But she was markedly improved, and it was just a cut and dry, like, it was the chelation therapy that did the trick there. So anyways, from my perspective, a successful case of treating heavy metal accumulation in the body. So that's the end of the story. I hope that was of interest. If anybody has any questions or comments about this topic or anything else, please post in the comment section below. I'll likely do 1 or 2 more of these successful case example videos, and then I'll get back to answering regular questions, because they are piling up in the inbox, and I'm thankful for those questions, because it gives me things to talk about that I know at least some people want to hear about. But I'll get back to those regular Q&As very soon.